Let's now look at the electrocardiogram. The electrocardiogram stands for electrical recording of the activity of the heart, was invented by Willem Einthoven, who was a Dutch doctor and physiologist. He invented the first practical electrocardiogram in 1895 and received the Nobel Prize for its invention in 1924. He discovered that the skin was able to conduct electrical signals from the heart, and he first recorded these electrical signals by placing his hands and one of his legs inside buckets of water. This electrical activity was then transmitted from his skin to the water into cables and finally into a huge machine that recorded the electrical activity in the form of waves. Before talking about the waves in the EKG, let's talk about the order of electrical activity in the heart. First, the SA nodes are going to cause atrial depolarization, which is seen in the bottom left picture. In this picture, the purple color represents depolarization. The second and very important step in electrical activity of the heart is the AV node delay of depolarization. This delay makes sure that the atria finish contraction and allows time for the ventricles to fill with blood. Then, the electrical activity will travel down the interventricular septum via the bundle of His and the right and the left bundle branches. Finally, the electrical activity will make its way to the Purkinje fibers, which branch off at the apex of the heart and will depolarize the ventricles from bottom up. Eventually, the ventricles will have to repolarize in order to be able to become depolarized again. Now let's apply what we know about the electrical activity of the heart to the EKG. The EKG is composed of waves, segments, and intervals. It also uses 5 letters: P, Q, R, S, and T. And these letters describe the waves and the peaks found on the EKG. The first wave that we see on the EKG represents atrial depolarization, which is shown by the first wave on the EKG. This wave is known as the P wave. On the second row, we see a flat line on the EKG. This flat line is also known as the isoelectric line and represents the delay at the AV node and is also labeled as the PR segment on the isoelectric line. Note that all isoelectric lines are represented by segments. On the third row, we find a huge peak along with 2 upside down peaks. This is known as the QRS complex and represents ventricular depolarization. If you notice, this huge peak looks like an upside down letter V, which should remind you of ventricular depolarization. On the fourth row, we find the last wave, known as the T wave, which represents ventricular repolarization. Note that there is an asterisk on the isoelectric line right before the T wave. This is the ST segment, which simply represents the start of ventricular repolarization. Finally, on the last row, there is a flat line known as the TP segment, which will be found between the T wave and the P wave. This represents no electrical activity. Note that anytime you have a depolarization, you will also have a repolarization following that depolarization. So when atria depolarize, they must also repolarize. Atrial depolarization occurs at the P wave, and atrial repolarization also occurs, but it's hidden behind the QRS complex. ventricular depolarization occurs at the QRS complex, and ventricular repolarization occurs at the T wave. Now let's cover the intervals of the EKG. First, let's cover the PR interval. The PR interval begins right before the P wave and ends at the beginning of the QRS complex. You probably noticed that the PR interval actually ends at the beginning of the Q peak instead of at the beginning of the R peak. The reason why it was named the PR interval was because in real life, this QRS complex is very compressed to the point where we cannot tell apart the Q peak from the R peak. So it was easier for physiologists to name this interval by using the R peak because it was easier to see this peak on the recording. Anyway, this PR interval measures the start of atrial depolarization to the start of ventricular depolarization. So it measures the time frame between top chamber depolarization and bottom chamber depolarization. The QT interval begins at the beginning of the QRS complex and ends at the end of the T wave. The QT interval only focuses on the bottom chambers and represents the start of ventricular depolarization to the end of ventricular repolarization. The RR interval measures the time between two ventricular depolarizations, which are measured from R peak to R peak. So far we have only talked about electrical activity in the heart. We have learned that pacemaker cells cause depolarizations. These depolarizations cause cardiac muscle contraction. Each cardiac muscle contraction leads to a heartbeat. A cardiac cycle, by definition, is the period of time that begins with contraction of the atria and ends with ventricular relaxation. In simple terms, a cardiac cycle is represented by the start of one heartbeat to the start of the next. In a cardiac cycle, there will be two periods. The first one is known as systole, which is a period of ventricular contraction. During ventricular contraction, the atrioventricular valves will close shut, and if you listen to your heart through a stethoscope, you will be able to hear a lub sound. Whenever you hear the word systole, think squeeze. Squeeze starts with the letter S, just like the word systole. The second period in the cardiac cycle is known as diastole, which is a period of ventricular relaxation. When the ventricles relax, the semilunar valves will close shut, which contribute to that dub sound. Whenever you hear the word diastole, think D for dilate, which occurs to blood vessels when they relax. Here we're looking at the electrical activity and how it relates to the cardiac cycle. Electrical depolarization will cause myocardium contraction. It's going to cause the cardiac muscle cells to contract. In this graph, we're focusing on the ventricles. First, we're going to look at ventricular systole, which begins at the beginning, or better said, at the QRS complex, and it's going to last all the way to the end of the T wave. Ventricular diastole is actually going to begin at the end of the T wave, and it's going to last all the way to the QRS complex. Before diving into the cardiac cycle, it's important to understand the relationship between volume and pressure. This relationship is clearly described by Boyle's law. Boyle's law says that volume is inversely proportional to pressure, as described by the formula seen in the middle of your slide. Boyle's law states that if volume decreases, pressure increases. Conversely, if volume increases, pressure decreases. Here we have an example describing the relationship between volume and pressure. On the left side, let's pretend we have a room with 6 people. When the room is large in volume, then the pressure is low and everyone's happy. However, if the walls of the room begin to cave in, then the volume will decrease, which will cause the pressure to increase, making everyone stress out. In summary, we learned that the atrioventricular valves are separating the atria and the ventricles, and the atrioventricular valves include the tricuspid and the mitral valve. The semilunar valves are separating the ventricles and the arteries and include the pulmonary semilunar valve and the aortic semilunar valve. All valves prevent the backflow of blood. We also learned about pulmonary circulation, which refers to the blood circulation that travels into the lungs from the right ventricle. We also learned about systemic circulation, which refers to the blood circulation that travels to the entire body from the left ventricle. We also learned about intrinsic factors. These are internal factors influencing electrical activity of the heart, and these include the pacemaker cells found inside the heart. These include the SA node and the AV nodes. We also learned about extrinsic factors. These are external factors influencing electrical activity of the heart, and these extrinsic factors include the sympathetic and the parasympathetic autonomic nervous system. We also learned about the muscarinic receptors, which are found in pacemaker cells of the heart, and these respond to parasympathetic release of acetylcholine. So once acetylcholine binds to the muscarinic receptors, the receptors are going to respond by slowing down the heart rate. We also looked at beta 1 receptors, which respond to norepinephrine, which is released by the sympathetic nervous system, and they also respond to the hormone epinephrine, which is made by the adrenal glands. And beta 1 receptors respond by speeding up the heart rate. Finally, we also looked at the electrocardiogram, which is abbreviated as EKG, and sometimes it's also referred to as the ECG. The EKG is made up by waves, segments, and intervals. A cardiac cycle is one complete heartbeat, which is triggered by depolarizations that cause contraction of the myocardium. We also learned that contractions cause the chambers to squeeze, which is a phase known as systole. When chambers relax, they go through a phase known as diastole. When the chambers squeeze, the volume in the chambers decreases, which causes pressure to increase as stated by Boyle's law. Alright, let's now go over a few questions. What is the advantage of the AV delay? You guys can pause it and then press play once you guys are ready. Alright, the reason why the AV delay is important is because it allows ventricular filling. It gives enough time for the top chambers, the atria, to push down the blood into the ventricles. Second question, is the response of a cell determined by the signal or by the receptor? Give an example. Alright, as we know, the response is determined by the receptor, not by the signal. Once again, by the receptor. And the example that we talked about was how acetylcholine is able to trigger a different response when it binds to the nicotine acetylcholine receptors and the muscarinic receptors. When acetylcholine binds to nicotinic acetylcholine receptors on the sarcolemma of the skeletal muscle, it triggers depolarization. On the other hand, when acetylcholine binds to muscarinic receptors on pacemaker cells, it actually triggers hyperpolarization, and in this manner, it delays depolarization.